Tongue ties in adults is characterized by a fibrous band at the base of the tongue that restricts movement of the tongue. Now, why is this presenting so late? The diagnosis obviously was not made when the child was newly born, not as an infant, a toddler, teenager. Sometimes it's not picked up because the child can cope with the normal lactation needs, which means the child has a tongue tie but is still able to feed adequately. Even with the impediment in suckling, if the mother has very good flow, the child is able to get enough milk. Now, as the child grows older and becomes an adult, pronunciation becomes a problem. Unlike children where it's a very quick snip and fix, if people say, for adults it's a bit more complex. We have to give anaesthesia at the base of the tongue. Dissection is done to remove anterior and posterior bands of fibrous tissue that restrict the movement, also known as the tongue tie. After that is done, sutures or stitches can be placed. In some instances, I might use a laser to help me do this procedure. Using a laser reduces the chances of bleeding. The procedure is usually uncomplicated and the patient comes back in 2 weeks' time and also at the 3-month mark. Following the surgery, after 2 hours, the patient will start to do a number of things. Number one, they'll do scar massage. Healing happens rather quickly at the base of the tongue. The tongue will want to fall down and back into its original position. If the area is not agitated, so using a finger, little finger, with digital pressure so that the fingernail blanches, and that's all the force that's required. If that is done 6 times a day for 30 seconds each time for a period of 6 weeks. The other thing that needs to happen are tongue lunges, which means putting the tongue out as far as possible, straight, left, right, up, down, going all the way to the back, extreme right, extreme left, and try to touch the nose. For the third activity, I would say that a simple activity called propeller is very useful, especially for adults. In propeller, we get the tip of the tongue to touch the front of the upper teeth and the front of the lower teeth, and you just make a circle like this and come back on both sides. All activities are 30 seconds each. And that completes what propeller should look like when you're doing it in front of the mirror for the first few instances. Following tongue tie surgery or lip tie release, typically what is prescribed are painkillers like paracetamol. For those who are concerned, we will prescribe yet a second class of painkillers, typically ibuprofen or arcoxia, to help with the pain. The pain is usually most marked for the first 1 to 2 days. Antibiotics are usually not required. In addition, frequent usage of mouthwash is recommended. Would advise using Oristil Green, that's a chlorhexidine mouthwash, and that should be used 3 to 4 times a day and certainly before you sleep. Mouthwash is used for a period of about a week, and at 2 weeks' time when I remove the stitches, I should be able to see a very nice, healthy, clean area. Next to note is that strongly advised not to have any form of dairy products in the first 24 hours because dairy, means it's milk or so, will tend to form a residue at the base of the tongue, and after which feel free to have whatever you like.